Are you a runner struggling with hip pain or low back pain? If so, we can help. I'm Dr. Dukes with Body in Motion. This month we're going over different aches and pains associated with running that people try all sorts of different things, and some of it works, some of it doesn't. So at the end of the day, it's understanding what's happening, and I'm going to give you some ideas to think about and an exercise to do that would help your hip or low back, as well as a cue to think about while running that might change some things, okay? So understanding, is your pain in the front or is your pain back here? That helps us to kind of figure out where those exercises would need to be. But you know, a lot of people with running, they have either hip flexor issues or glute tendonitis. But I'm trying to give you like the biggest bang for the buck type of exercise, and also understand your problems associated with the way that you're running. So when we think about the biggest mover to the hip, it's making it more stable and then making the hip flexor not as overactive, right? So if we can make our glute med and min work more to offload the front part of the hip, the overall hip and low back are going to be a lot happier. So to do that, we'll use a foam roller. It doesn't have to be a foam roller, but I have one, so that's what we're going to use. So what you're going to do is you're going to lean into a wall, and there's a couple ways that you can do this. So I'm going to show you two different variations. So I'm going to show you the isometric, which is just holding a position. So we're going to imagine I am leaning forward like I'm running, right? Not sticking my butt back, but bringing my butt with. So I'm going to do that, but I'm going to be on one leg, pitched forward, and then I'm going to push this knee into the foam roller. And that's going to light up the outside of this leg and this glute, and I'm going to just hold for 20 to 30 seconds and then do the other side, okay? So that's option one. Option two would be to add a little bit more movement. So we're thinking about, we're trying to counteract an increased pelvic drop when we run and we're on one leg. So this one is just challenging just that. So I'm leaning forward, I'm going to let my right hip drop down and then come back up. That's the other option. Those are the two exercises that could be a great prep before you run, and also an exercise you could do after. So then what we're going to talk about as far as your running mechanics, the big things that I think about that would change what we just talked about in that exercise, the pelvic drop or the tilt from side to side, is posture. So we're going to think about running with a neutral pelvis, right? And then the next piece would be to have a little bit more of a forward lean. So if I take my pelvis and roll all the way into sticking my butt out, that's not great. That makes my back hurt. And if I go all the way so that I almost have no butt, then that flattens it, and that's not great either. I can't absorb shock in either position. So we want to be in that gray area in the middle where I have some wiggle from side to side and my body can move and adjust, right? So finding that neutral pelvis and then getting that forward lean, getting my belly button past my toes, is going to really help offload the lower back and hip joint a lot. That lean forward is going to shorten your stride, so it's not going to be so compressive. And then that neutral pelvis is going to open up the facet joints and make your lower back happy. So if this is something that interests you and you want to learn a little bit more, feel free to schedule a discovery call or book an appointment online. And then we also have the 3D gate system that we could really look at the way that you run if you think your form is the problem.